Thank you, everyone. This is the 2024 special enrollment presentation for Lincoln Park Public Schools. My name is Elizabeth Roldan. I'm here joined by my colleague Julie Servideo, as well as Michelle Cook from the district. IMEC Insurance Agency is the broker for the district's health benefits. We are here not only to answer any questions about enrollment, but also we do quite a bit of claims advocacy. So if you ever have an issue with a claim, whether it's for your medical, prescription, and or dental that you are having trouble resolving on your own, feel free to contact our office. You can send us an email to you can send us an email or give our office a call. You can call our office at 973-450-9800. You can also send us an email to info@imacagency.com, and we will get back to you usually same day, sometimes even within the hour. We want to make sure that everyone has the answers that they need in real time, especially if you're dealing with a claim matter or a prior authorization or any other question or issue related to your health insurance benefits. So in an effort to control healthcare contribution costs, the Lincoln Park Public Schools District has changed how its table for out-of-network for the Direct Access 10 plan. So this change has only affected the Direct Access 10 plan, and the table that you have currently, that you had before, I should say, is the Fair of Health Geo table, and now it is called the Fair Health National table. The out-of-network reimbursements still remain greater under Direct 10 compared to all the other plans that are offered in the district. Employees that wish to make a plan change during the special enrollment period may do so. We are going to be going over the plan differences with all of the other plans in case you are considering a change. The deadline for this special enrollment period is next Friday, which is December 20th, in order to process that, and those changes would be effective as of January 1st. All of the plan benefits have remained the same for all your other plans, just with the exception of this out-of-network table for the Direct 10 plan. And we want to make that abundantly clear that the only change that was made was to the out-of-network only to the Direct Access 10 plan. During the special enrollment period, you will have the following options, which are the Direct Access Plan, the Omnia Plan, the New Jersey Educators Health Plan, or the Garden State Health Plan. For those of you that were hired on or after July 1st of 2020, there is a law in the state of New Jersey that requires those employees hired on or after that date to only be able to elect from the New Jersey Educators Health Plan or the Garden State Health Plan. But for those of you that were hired prior to that July 1st, 2020 date, you can elect from any of the 4 plans that are being offered. Your out-of-network tables, depending on the plan, vary. So for example, under your Direct Access plan now, the table that you have out-of-network is 80% using the Fair Health National table. For the New Jersey Educators Health Plan, as well as the Garden State Health Plan, both of those plans utilize the Medicare table. They call it 200th percentile of Medicare. One thing to note is that the Garden State Health Plan does not have any coverage outside of the state of New Jersey, and that is a big thing that we like to highlight to members. If you are considering either the Educators or the Garden State Health Plan, which have the same benefits for the most part, the contributions are a little less under the Garden State Health Plan. The thing to note about the Garden State Health Plan is that it only offers coverage within the Garden State, so only within New Jersey. Omnia is a 2-tier network that does not have any out-of-network coverage. And based on this graphic, as you can see, Direct Access 10 still has the most generous reimbursement table when you are utilizing doctors out-of-network. We like to encourage everyone to utilize in-network providers because really, as a member, that is where you are going to be saving the most money. In-network providers are contractually obligated to only charge you for your $10 copay, whether it's a primary care doctor or a specialist, which is why they cannot balance bill you. Out of network, there is really no way of controlling costs because out of network doctors, because they have no contract, can really bill whatever they want for their services. And as you can see, based on the plans, there is only a certain amount that is going to be covered out of network, which is why your most cost savings would be to try and stay in network as much as possible. We put together this contribution table, and I know that this was included in the materials that were distributed yesterday. So I apologize if it looks a little bit smaller on your screen, but we did under 3 different salary brackets what the savings would be for someone, let's say, moving from Direct 10 to the educators plan compared to the Garden State Health Plan and compared to Omnia. As you can see from this table, definitely the Direct 10 is the most expensive contribution-wise plan that there is, but it is also the most benefit-rich plan that is offered by the district. We did 3 salary brackets of 58,000, 72,000, and 100,000 just to showcase what the what the contribution savings would be, excuse me, um, comparing one plan to the other. But as we are going to get into in a couple of slides, there are plan differences that certainly need to be considered. When you're making a decision as to what plan works best for you and or your family, you have to consider obviously how it's going to work for you medically, but also financially. So taking a look at your savings is great, but making sure that it meets the needs that you have, whether it's a specialty medication that you're on that may not be covered under the educator's plan the way that it would be covered under Direct 10. Those are certain factors that we like to have members consider, and this is why we highly encourage members that are considering a change to reach out to us. We'll have that conversation with you one-on-one. We love to speak to members about how their current utilization of benefits is in order to make sure that they're making the best decision for them and for their family. The plans are all great, but they are definitely not one size fits all. So it's just a matter of finding the one that would work best for you and your situation. We also put together some examples of what the out-of-network looks like under the current Fair Health National, what it looked like under your Fair Health Geo, which you had previously for the out-of-network, as well as what it would look like under the educator's plan. So for the most part, as you can see, the red column here are your current out-of-network reimbursements for these top codes that we looked at the group's utilization. So for example, what we see that most people do out-of-network is general office visits, psychotherapy, IV chemotherapy, modified radical mastectomies, knee replacement, physical therapy, chiropractic therapy, and acupuncture. So those codes that, as you can see here, are the top used out-of-network codes that Horizon provided to us. And as you can see in the red column, this is what those payouts would be under your current Direct Access 10 plan. And here in the blue column is what you would be getting back should you do the New Jersey Educators Health Plan or the Garden State Health Plan. As you can see, the reimbursements are much more benefit rich, and the amount of money that you're going to be getting reimbursed for those services is much greater under the Direct Access 10 than it is under the New Jersey Educators and the Garden State Health Plan. The Garden State Health Plan and the New Jersey Educators Plan offer significant savings as far as your contributions, but that comes as a result of them reimbursing much less, as you can see, on those out-of-network top services, for example. As I mentioned, Direct 10 still has the greatest allowable out-of-network reimbursement than the New Jersey Educators Health Plan and the Garden State Health Plan. This is just an example that we put together under your old Fair Health Geo, which was the out-of-network table that used to be used under Direct 10. A doctor, let's say, would bill $300. Horizon would take a look at that out-of-network claim and say, okay, based on the out-of-network table that we are using, we would have, that service should have been billed at $245. Horizon at that point takes their 80% of coinsurance, which is the blue box here, that's $196. And you as the member would pay out your 20% in coinsurance, which does get applied towards maximum out of pocket, which is here, this orange box. But this red box that is still part of that original bill of $300 for that provider, that $55, that is what is known as balance billing. And that is, as a member, what you would be responsible to pay. And again, this $300 that is billed by the provider is definitely up to that provider, and they can bill whatever they want because, again, they're not contractually obligated to a certain dollar amount as in-network doctors are. Under your Fair of Health, for example, of national now, Same scenario, $300 billed by that provider. Horizon is deeming that as something that should have been billed at $220. So breaking that down between the 80% that Horizon is reimbursing in the blue table versus the orange that you're under your 20% you're paying, you're getting back, or I'm sorry, that you're contributing towards your coinsurance. Under this scenario, you're left with an $80 balance bill. So again, it's important to realize how out-of-network actually gets processed. And something that I let people know all the time is that you can certainly get a predetermination of benefits before a service is rendered out of network. So if you're seeing an out-of-network provider, they're going to perform a service, you can certainly request of them to give you a list or an amount to see a predetermination, I should say, of what they're going to get back from Horizon, what they're going to bill you, so you know what your out-of-pocket expense would be. And that's something that I highly encourage everyone to do, whether in any plan that you're going out of network, just so you don't have a surprise bill. Under the educators plan and the Garden State Health Plan, we do like to remind everyone, as we did during open enrollment, those three services out of network are capped at certain dollar limits, and this is based on the Chapter 44 law. If you are in the educators or the Garden State Health Plan out of network, acupuncture is covered at up to $60, physical therapy is covered up to $52, and chiropractic services, which are limited to 30 visits per calendar year, are capped at $35. Again, this is only for the New Jersey Educators Health Plan and Garden State Health Plan, and only out of network. When we talk about out of network under those two plans, for example, we refer to that as the CMS or the Medicare table. Again, because you are going out of network, those providers can truly bill whatever they'd like. And whatever your plan covers versus what the amount that is billed, that is considered balance billing. So you as a member are responsible to pay that bill in whole to that provider that you are choosing to see out of network. And again, just to reiterate, the Medicare table that is used under the educators and the Garden State Health Plan is a lesser reimbursement that you are getting under Direct 10. So just to compare all four plans against one another, they all utilize the same network in the state of New Jersey, which is called the Horizon Managed Care Network. The national network is the Blue Card PPO network, which is why you have that little suitcase that says PPO on your Horizon ID card, with the exception of course, the Garden State Health Plan, which does not have national coverage. It only has coverage inside the state of New Jersey. Your primary copay and your specialist copays vary depending on the plan, but usually they're in that $10 to $15 range, with the exception of Omnia. Omnia is $5 in Tier 1, $10 in Tier 2. But again, Omnia does not have any out-of-network coverage. That is a very important distinction that we like to highlight to members. Your annual well visits are covered in-network at no copay at all under all four plans. Your deductibles vary depending on the plan that you choose. There is no in-network deductible or deductible in Tier 1 under Omnia. Out of network or in Tier 2 under Omnia, you are subjected to the specific deductible as listed on the screen. Same thing with out-of-pocket max, which is the most that you would lay out in a calendar year in network, for example. You do have different limits in network and out of network across all four plans. None of the plans that are being offered require a referral, so you can completely see a specialist of your choosing under any of the plans without having to get a note or a referral from your doctor. Your labs across all four plans are still LabCorp and Quest. And again, there's no charge in network or in Tier 1, but out of network or Tier 2, you are subject to your specific deductible and or coinsurance. Outpatient surgery, again, covered at no charge or covered 100%, I should say, in network. Out of network or Tier 2, you are subject to your specific deductible or coinsurance. And your emergency room copays do vary depending on the plan, but if you're in Direct Access 10 or Omnia, it's a $25 copay. In the educators or the Garden State Health Plan, it is a $125 copay. But if you are admitted into the hospital, those emergency room copays would be waived across all four plans. One other highlight that we like to make for those members that are choosing to move to the New Jersey Educators or the Garden State Health Plan, it is very important to note that those plans do have a very different list of covered medications. There are, it's a smaller list of covered medications, and it has a mandatory generics requirement. So it's important to note that if you're going from your Direct 10 plan to the Educators or the Garden State Health Plan, your prescription would also be changing. And you would have, like I said, that mandatory generics requirement where if you are on a brand name drug that has a lower cost generic option available, that's what's going to be covered and dispensed under the Educators or the Garden State Health Plan. So that is a very important distinction because the plans not only have to work for you on the medical side, they also have to work for you on the prescription side. So I've come across many members that maybe they don't go out of network, but there are certain prescriptions that are brand name that they don't want to have the generic version of, which is why they tend to stay in the Direct 10 plan, or vice versa. Maybe they do go out of network and the prescription is fine, but again, if you're somebody who's going out of network with a certain degree of frequency, the Direct 10 plan is still your best option because it is the one that is going to give you the most generous out-of-network reimbursement available. For those of you that are doing a search on the Horizon website just to check out the drugs that are covered under the New Jersey Educators Health Plan or the Garden State Health Plan, you would look at the Net Results Enhanced Formulary list. Under Direct 10 and under Omni, it's called the Classic Formulary, but under the Educators and the Garden State Health Plan, it's called the Net Results Enhanced Formulary. We actually have the links for both of these on the IMAC benefits portal, which we have a slide coming up about that, and we had it at the beginning of the presentation as well. So I would highly recommend that you make sure that you bookmark the portal because it's everything that's posted here and everything related to your health benefits is on the IMAC benefits portal right now for the district. So next steps, if you are staying with the plan that you currently have and you're happy with it and you don't want to make any changes, there is no action required on your behalf. If you are, however, making a plan change, that is due by next Friday, December 20th. You would have to complete an enrollment form. As I mentioned, we do have everything posted on the IMAC benefits portal that you can do a side-by-side comparison of all of the plans. You can also do a search of participating providers, but like I said, all 4 plans do utilize the same network of doctors, so there's no disruption from that standpoint. This, again, is a special enrollment period. Your normal open enrollment period would be next May for an effective July 1st date. And if you are going to be making a plan change now during the special enrollment opportunity, please make sure that you complete your enrollment form and send it to Michelle by next Friday. Michelle's address is cook@lincpk.com. This is the IMAC benefits portal that I was referencing just now. So if you want to bookmark in your browser imacbenefits.com, the guest key is the same for everyone in the district, which is LPBOE, all in caps, no spaces. Everything that we've presented today is currently on the portal, including a contribution calculator if you wanted to evaluate what your contributions would be under, let's say, Direct 10 versus what they would be in the Educators Plan, for example. The calculator is posted on the portal. This is actually what it looks like. It's an Excel spreadsheet that's on the portal that you can download and calculate your contributions. You do need to have Excel in order to use it. So if you don't, feel free to call our office. We can run those numbers for you over the phone. But with that said, that really does bring us to the end of our presentation. I don't know if any questions have come through the chat. Julie or Michelle, is there anything else that you would like to add?
Not this time.
Perfect. All right, everyone. So with that said, I'll give it a minute or two. I don't see any questions. Yes. Yes, can I help you, sir? Did you have a question?
Or hopefully you can hear me. My mic
Yes.
keeps clicking off on me. Thank you for the presentation. And I know I believe that questions were to go to the chat.
Yes.
But I just wanted to make sure that before we go off the air, if you will, if there are any questions that you can help us with. Um, I don't claim to be, the insurance expert, but I have been able to follow all of this. But I just want to ask before you get off, if there are any questions. I don't want to miss the opportunity while we have you on board, just to see if there are any questions that some of our staff members have that might be helpful to them as they make a decision. The other question, Michelle, are you on board here? Michelle Cook, are you still here?
Yes, I'm here.
Okay, thank you, Michelle. So the information would go to Michelle before the 20th, or hopefully even before that, the 19th or whatever, if that's possible. And so are there any questions that could be asked or at least put into a chat? I'm not too familiar with Teams here, so I see a chat there. Anything that anybody wants to ask before we close this session off?
And also, I do want to reiterate, if you do think of something after the fact, feel free to call our office. We are there 8 to 5, Monday through Friday. We would love to have those one-on-one conversations with you, just to make sure that, we are answering your questions so you're making the most educated decision for yourself and for your family.
The other thing I just wanted to mention along those lines, particularly to Julie, who has been so incredibly responsive to all our inquiries. We really appreciate that. You understand the sensitive nature of this for our staff, and you recognize the need to take some action to help us out. So I appreciate all of your efforts, but particularly Julie for her prompt responses to any of our inquiries and calls. So that's important. Does anybody have a question for any of our?
I have a quick question before we end. Sorry to interrupt you. My question is, if I end up changing my plan to a different one, will I be able to be offered the Direct 10 again, or is that no longer an option?
That is a great question, and I love that you asked that because it does come up time to time. Everything is based on your hire date. So as long as you were an employee that was hired before July 1st of 2020, you will always have the Direct 10 as an option. And really any of the plans that are offered during open enrollment, you'll have the ability to choose from any of them. Great question.
Okay, so it's the hire dates before 2020, you said?
July 1st of 2020. If you were hired before then, you can choose from any of the plans that are offered during open enrollment.
Thank you so much.
Absolutely. Yeah, and just to further elaborate to that, Julie and I travel to a lot of school districts in the state, and I can tell you that there is a bit of a rumor out there that if you leave Direct 10, you can never go back to it, and that's completely false. You can switch back and forth every year. Right now, if you wanted to leave Direct 10, for example, to move to the educator's plan, at most you'd be committing for a 6-month period, because since you have this special enrollment opportunity, you will have your regular open enrollment next spring for an effective July 1st date. So that's certainly an option to think about. But yeah, you have your annual open enrollment opportunity to make those changes every year.
Thank you so much.
Any other questions? Excuse me, one thing, Julie, I didn't get the name of our other presenter, and it didn't come through when you were being introduced. So it's Julie and
Elizabeth.
Elizabeth, thank you, Elizabeth.
Yes, absolutely.
I know you put a lot of this work together for us, so we really, really appreciate that.
No, our pleasure.
Any other questions for any of our experts here? I'm not hearing any, am I?
I don't see any hands raised or anything coming through the chat.
Nothing? Okay. That being said, I'd like to thank Julie and Elizabeth for all their hard work and their prompt responses to all of our issues, and to our staff members, thank you for being here. And if we can do anything to help you, again, I am not an expert on this and claim no such title, but we certainly can get answers from people who know this area very well. Okay, so thank
Perfect.
you all.
And we will be sharing a link for this recording sometime within the next 24 hours. So that can also be distributed to all the district employees.
Okay, so you'll get that to me, and from there, we'll get it out?
Yes,
Okay, that'd be, who's this? That's Elizabeth, right,
Yes.
speaking? Thank you,
Yes.
Elizabeth.
absolutely.
Okay, thank you all, and have a great night, everybody.
Thank you,
Thank you.
everyone.
Have a good night.